Well, thank you for the question. So it's very similar to the bill that we had in the 2017 session that did not get out of Ways and Means. So Representative Greenlake's bill will have at least two components. One is the piece around all CCOs having to have public meetings to be transparent in their kind of operations. One of the things we saw, I think, in the family care situation, we had no access to the board conversations that were taking place when they made the decision not to move forward with their next contract. So you'll have a public meetings portion. There will also be the language around what do you do with reserves, and it will direct the department, as the legislation did last year, to look at levels of reserves and whatever certain levels of reserves should be redirected to social determinants of health to kind of work at the longer term prevention issues. There will be some other amendments that will come and there will be up for discussion anywhere from when you should give notice of non-renewal. So in the case of family care, we had a non-renewal very late, and if we weren't able to renegotiate for another month, we would have been dealing with the transition right at the end of the calendar year. So there'll be an amendment for non-renewal. There'll be some amendments looking at whether or not we have to do more around equity data within the Medicaid program. That hasn't been discussed at all. So those additional amendments, which will be a little new to the game, will be up for discussion, but the base bill will be about public meetings and how to handle reserves.
Is that all that needs to happen as far as improving accountability and transparency? Because OHA actually took the step of not going to another 5-year contract, right? They just did 1-year contracts because they needed more teeth or they wanted them to be more accountable.
Mm-hmm. Well, right. I think what's happening now in the agency, and I would say speak with them directly, my understanding is the current contracts are being reviewed to make sure that they are being enforced and making sure all the aspects of the current contracts are actually being followed. So I think they wanted that due diligence. In terms of the contracts that would go into effect in 2020, one of the reasons we're doing this bill around public meetings and reserves now is that you pass it now, they're going to start developing the RFP for the contracts into 18 and early 19. If we came back in 2019, it might be a little late to take that up. So again, there'll be some other amendments related to CCO transparency, so just watch out for this.
And I just wanted to talk over the Republican leader. Is that enough?
Oh, we'll have to look at the bill. Our disagreement with the speaker in the past has been over the exclusion of for-profit providers. And that has been the center of our disagreement because we believe more providers are better in that there should not be a distinction as to the validity of a provider of Medicaid services based upon the entity's status as a for-profit or nonprofit. If that's excluded from the bill, and I don't know if it is.
It is currently not in the bill.
Okay. Then what she has to say seems reasonable, and we'll look at it. Our vice chair for the healthcare committee, Cedric Hayden, as you may have heard, thinks a lot about Medicaid and services, and so he knows that world very well, as does Representative Dr. Bueller. So we'll look for them to counsel us.